Hi, folks. Thank you for bearing with us. Looks like Dan is having a few technical difficulties, but he will be joining us just as soon as he can. In the meantime, we want to be respectful of your time, so I think we're going to kick things off, and I will have our panelists introduce themselves, starting with Liz.
Hi, my name is Liz Castaldo. I'm the program director with Early Childhood Partners. We're a nonprofit organization serving the Eagle River Valley, and I'm happy to be here.
Awesome. Thanks so much, Liz. Teresa, would you like to go next? Oh, I think you're on mute.
You're right. Hi, everyone. I'm Theresa Haynes. I'm a licensed psychologist and a clinical supervisor with the Hope Center.
Wonderful. Thank you. Melisa.
Hi, everyone. Good morning. I'm Melisa Rewold-Thuon. I'm the assistant superintendent over student support services at Eagle County Schools, which basically means everything that's mental health, kids that need extra assistance, multilingual, grants, and now COVID.
Wonderful. Thank you. And Kayla.
Hello, I'm Kayla Bettis. I'm the Outreach Operations Manager for Special Populations at Eagle Valley Behavioral Health. I've been in the Valley for 13 years and also a clinician, and I'm working with wraparound services and ways to fund additional initiatives so everyone can attain behavioral health services in the Valley.
Wonderful. Thank you so much. And I am Jo Pennock. I'm not Amy Keller, although we are using her Zoom account today. So thank you, Amy. So we want to thank everyone for joining us for this virtual town hall focused on school programs and behavioral health. For those who may not know, in 2019 in December, Vail Health Foundation announced its It Takes a Valley Transforming Behavioral Health campaign. And our goal is to raise $100 million over 10 years for EVBH. In June, the foundation hosted the first ever virtual town hall as a way to share news and information, showcase partner nonprofits already doing great work in behavioral health, and raise awareness about the campaign and share ways community members can make a difference. The past town halls were recorded and available on the foundation website. This one is also being recorded and will be available at the end of the day. Today, we will talk about COVID-19 in terms of schools. We have dedicated a town hall in early December focusing on COVID-19 in the community, and Dr. Engel from CMM will be a panelist. So thank you, Melisa, Liz, Kayla, and everyone for joining us here today, Teresa as well. We really appreciate it. It looks like Dan has joined us, so I'm going to pass it off to him.
Great, thanks, Jo. And again, sorry everyone for the delay in starting this morning, but it seems like we've got it together. So again, I'll echo what Jo said. We appreciate you being here. This is the fourth virtual town hall surrounding It Takes a Valley campaign regarding behavioral health. And so, today we're going to talk a little more in depth about what's going on in the schools. We're going to start with early childhood and take it all the way through high school. And I think, again, we've got a great group of panelists. Look forward to hearing what they have to say. So maybe we should jump right in. I would mention to all the participants, please use the question and answer tab on your screen if you've got a question. And we'll be happy to, again, engage in a fairly lengthy question and answer session once we get through the presentations from everybody. So with that, let me introduce Liz. Liz has been in the Valley since 1995. She's worked in a variety of roles in early childhood since that time. She was a director of child care program in Vail, early childhood council director. Again, it's just been very active in a variety of early childhood positions. And I think she's got quite a bit to tell us about. So Liz, why don't you kick us off with some talk about early childhood.
Sure, happy to be here. Again, I am with Early Childhood Partners, and I know that one of the questions we were asked was, who is Early Childhood Partners and who do we serve? Very pleased to be able to highlight the connection between early childhood and mental health. I know that early childhood is less familiar for many people than, say, a school district or a community mental health agency. So I'm really going to try to do my best to explain the why behind early childhood mental health consultation services. We serve young children and caregivers of young children, including parents and child care providers. And I have to say, many people don't realize that mental health problems can and do occur in very young children, which is why we're so grateful to be able to have this discussion today. And that the presentation of things like mood disorders and neurodevelopmental differences, post-traumatic stress, ADHD, and more is often missed in our youngest children and really viewed as merely behavioral. So we have some concerning statistics that only about 1 in 8 kids under the age of 6 receive an appropriate diagnosis in Colorado. And we also know that 50% of children who displayed emotional or behavioral problems at age 3 received ultimately a psychiatric diagnosis by kindergarten or first grade. I believe we're doing better than that in Eagle County, but there's so much more to do. I would say prevention and early identification can be the key to reducing some of the significant mental health problems we see in adolescents, teens, and even adults. So early childhood mental health consultation and working with young children's caregivers is a proven strategy. We like to describe as a continuum of services, which means it spans promotion, prevention, and intervention. And when treatment is necessary, it aims to connect children and families with the most appropriate evaluation to determine a diagnosis and treatment plan, which is really key for young children's success. So I guess I should go on here.
Liz, talk a little bit about, the connection with EVBH and maybe what you've been able to do, because of the connections and the support that EVBH has gotten around the community. And again, everybody on this call, I think, believes in what we're doing, and maybe draw the correlation between your entity and EVBH's support.
Yeah, we were very fortunate to have a partnership with EVBH and going back to the Total Health Alliance to be involved in the effort to highlight mental health. And as we all know, we have a crisis in our community. And to have early childhood embraced was really just so powerful to us because it's not a conversation that happens as much. And I know you would ask to describe some of the behavioral health services offered to children and families, and thanks to the support of EVBH as well as other foundations. Just to touch on that a little bit, as I mentioned, the early childhood mental health landscape is a little different because young children are literally never separated from their caregivers, and the interactions young children have with their caregivers can really either help or hinder their development. Again, we know that persistent adverse early childhood experiences can produce chronic inflammatory conditions that can last a lifetime, impacting their health, heart disease, diabetes, depression, arthritis, on and on. So we look at this treatment and intervention in the lens of prevention first. So prevention includes working with all caregivers to assure that they have the skills to support young children's social and emotional health. While intervention and also supporting the overall health and needs of a family is critical. So just to kind of frame the context that young children's mental health and later mental health is dependent on the support of the caregivers, right? So our services include things like evidence-based parenting classes offered throughout the year, all in English and Spanish, ongoing teacher training and childcare programs, including things like a social emotional curriculum, home visitation services focusing on increased caregiver child attachment and mental health, and also a really key role, and this is where I think EVBH has been a big champion as well as Eagle County, family resource specialists aimed at helping each family access individual needs. Then to the intervention side, before we get to evaluation, we look at things like screenings for kids to identify where they're struggling and an appropriate referral for diagnosis. All of this, hinging on providing support to all caregivers. And in the case of young children, we're meaning families and often childcare. I don't know if an example would be good to help that make sense. I know that's a lot of words.
Yeah, go ahead, Liz. I think everybody's surprised, or no, I was, about young kids and why do they have mental health issues? And so maybe, again, talk a little bit about, about that.
Yeah, absolutely. There's a variety of reasons. Sometimes we don't always know. There are developmental disorders. There's also, like I said earlier, children can have a variety of mental health problems. Could stem from trauma and risk factors, certainly, doesn't always. And when we look at the risk factors, that's really why I kind of talked about this family-friendly wraparound approach that we know is the key to wellness among families and among children. And then the diagnosis, we want to do better than children not being identified until later in elementary school. Because sadly, the trajectory for kids, if we really don't figure what's going on, kindergarten, first grade, second grade, it's not good for their kind of lifelong success. So kind of an example to make this sense and how it works here in the Valley and with our organization. In this case, let's say we receive a call from a child care program, which we often do, thanks to many years of partnerships with them and support. They're concerned about a behavioral or a developmental issue. Parents would then sign a release for ECP consultants, and we would quickly convene a parent and teacher meeting. We would identify the child's strengths and challenges, and oftentimes referrals would be made for that developmental, psychological, or other evaluations to determine if there's a developmental delay or a disability that isn't yet discovered. Other times, consultants work with caregivers to come up with strategies proven to remediate young children's challenging behavior. And sometimes only a couple of sessions are needed, and other times we could be involved for months or even years. I should say also, many families are struggling with a multitude of issues, including housing or food insecurity, which is where, say, our Family Resource Center would come in, or with making connections with their children and coping with challenging behavior, which is where a mental health consultant or home visitation service could come in. Because what we know is that if caregivers aren't okay, then young children aren't okay.
Yeah, it's interesting. Well, Liz, thank you. Let's move on to Teresa. Theresa Haynes, who is a licensed psychologist and a clinical supervisor with the Hope Center. Again, go ahead and maybe tell us a little bit about what you're doing. We've heard from the Hope Center in past town halls, but we're glad to have you here today. And yeah, please share some of your thoughts.
Yeah, thank you, Dan, so much. And I just really want to express appreciation for being able to be here today and to be able to talk about the Hope Center. So the Hope Center is a nonprofit agency. We have both a 24/7 crisis line and a crisis team, skilled clinicians that man that line 24/7. And we also have a school-based team. So today I'm really here to talk about our school-based team, as that's the topic of this town hall. Ultimately, the Eagle Hope Center came to Eagle County in 2018 in October. At that time, we had the crisis line 24/7, and we had 4 school-based clinicians. And because of our partnership with EVBH and as well as community partners, we have now grown to, we currently have 12 clinicians in 13 schools in Eagle County, and we have 2 clinical supervisors. So amazing amount of growth. Again, tremendous gratitude for EVBH and our community partners for allowing this and really supporting the work that we're able to do. Just to kind of give a snapshot of the work that we do and what the importance of the work that we do is our clinicians are housed in the schools. So we are available in the schools to meet with students, to meet with families, to collaborate with administrators, to collaborate with school counselors, and just really to be able to support the mental health and behavioral health of our school-aged kids. A really unique and I think incredible aspect of our services is that we are removing the barriers to mental health. So there is no cost to our services to the kids and the families that we serve. Again, this is, directly due to the support of EVBH, our community partners, that we're able to provide these services. So we remove barriers, not only financial, but transportation, scheduling, access. Again, we are right there in the schools, able to be a part of the schools, to be a part of the community, and to remove any barriers that may be in existence to providing this service, this well-needed service. And I have to say that I strongly believe that there's a large amount of our school community that would not be able to receive these services if we weren't in the schools providing these services. Certainly not the consistency of the services that can be provided in the school. I think also another unique aspect I just love to mention is that I think the idea of us being in the schools also directly relates to our mission and vision of reducing the stigma of mental health. So, for example, we have, I've heard from so many clinicians, I've seen it in the schools where clinicians are walking in the halls and, a student's walking in the hall and turns to his friend and says, "Hey, that's my therapist. She's so cool. He's so nice. You should really go talk to them." So it's really just normalizing this access, I think, to mental health support, reducing the stigma, which I think is huge and very valuable and very needed in our community. Let's see what else. I think one I want to speak to also just the depth of our program. Again, through the support of EVBH, we have been able to increase our program. We've been able to provide our clinicians with increased training opportunities, professional development, employee retention incentives. A huge role of EVBH has been also to really increase the collaboration between partnerships. When the shutdown, stay-at-home orders first happened due to COVID, we were able to quickly and seamlessly connect families and individuals to other community agencies. And that has been huge. Our elementary school provider is collaborating with early childhood partners and you, Liz, to just to really wrap around a family. We have made lots of referrals to CMM, to their IOP program that just recently started in October. Mind Springs has some emergency slots available for us to utilize. So it's really that collaboration effort that's been huge in just helping families. I want to speak just quickly. I think there's, if it makes sense, because there's a lot of questions about what we're seeing with kids during COVID, what are kind of the ramifications of that. People are really interested in that. So I just want to say that, and I think in many ways, many of us have heard this before, there's increased anxiety, there's increased depression, there's a great increase in suicidal ideation. Our clinicians are seeing students that, this time last year would not have been on anyone's kind of high risk or high concern radar, but because of everything that has been happening, they definitely are. And just the level of interventions that our clinicians are doing has increased significantly from last year. And I also, because I feel so passionate about this work, I have to just say that I really see the incredible gratitude and the incredible resilience in our kids, as well as our educators, our administrators, our school counselors, the people who are in there doing work day to day. It's an incredible amount of stress, incredible amount of anxiety for everyone, and the resilience is really incredible. So,
Yeah, could not agree more. And thank you, Teresa, for all that the Hope Center is doing. So I appreciate that. Next up is Melisa. Melisa has the easy job of assistant superintendent in a very strange school year. And so, she's going to talk a little bit about what schools are open, 2 days a week, 4 days a week, high school kids, and some of the challenges I know that the district has really stepped up and met. As I look at other school districts around the state, I'm proud of ours in Eagle County. So again, thank you, Melisa, and go ahead and share kind of what your thoughts are.
I had to unmute. First, I just want to say thank you from the school district on behalf of all of our students and our teachers for everything that the community has done to support our students, support our staff, to support our families, because this is a very strange time that we are all living in. And we are, as Dan said, very proud that we've been able to bring students back to school. We'd like to be a little bit greater capacity at the high school than we are right now. To meet the needs of the students. It's one thing that we are seeing. We see it most in our high school students, the isolation, because our high school students are only in school 2 days a week right now. I would say that we have a much greater risk of students not connecting to others, not reaching out for help when they need it, and a lot more anxiety. We're asking our kids to be independent learners, where we might ask college students to do that in the past, but they just have to be much more, what Teresa said, resilient. They have to be much more self-directed. Again, our high school students are missing out on a lot of the activities that we all grew up with, that kept us in line as students. Reduced sports, reduced club interaction, reduced social outlets. And so where we see our biggest risk of students right now in the way that we're operating is with the high school students. Our elementary school students and our middle school students, middle school, besides the fact that they don't have really the sports outlets that they used to have, or the club outlets, they're in school pretty much 4 days a week and doing pretty well as far as that. And then our elementary students, they have these very tight-knit classrooms right now, very small cohorts of kids with teachers. And all of this is in place so that we can really help to isolate who we need to take to remote learning in the case that we have outbreaks of COVID. But things that we do see in the school district right now, we have seen a reduction in the number of students that we refer to Child Protective Services. With everything that's going on in the community, that's a concern for us. It's because we don't have the same eyes on some of our students that we've always had in the past, and the ability to connect and have those same relationships. I think that we're actually in an incredibly fortunate place in our community, thanks to all of you, and thanks to the programs that have been offered through Eagle Valley Behavioral Health and the collaborations. If this had happened 3 years ago, which is kind of what I look as like a historical perspective, the support systems that are in place now are keeping us at a more even keel, I think, than a lot of other communities may be. In the past, we did not have Hope Center clinicians, which have been a godsend to our school. We did not have multiple counselors at middle school. We did not have alignment with a lot of other community service providers as far as prevention curriculum. So we've made great gains in the last 3 years, thanks to the funding and the programs that have been provided. As far as alignment, one of the things that we've really worked towards is looking at that prevention curriculum and making sure that all students across the district are getting consistent. And so we work with the preferred providers that are in our community that have always come in. A lot of times they had a relationship with a principal, they would come in and do a program. So we're looking at people like Speak Up, Reach Out, Bright Future Foundation, Mountain Youth, the Red Ribbon Project, all of these service providers that give our students a background and start opening their minds, and UBU, sorry, for mindfulness, for prevention services, for self-awareness, for self-regulation, and just general health and well-being. And so in the last year, we've really been able to align those service programs for our students for prevention. And then we have layered on top of that the Hope Center clinicians. So when a student is in crisis, we're able to immediately come in. And I think the huge difference that we've seen, and it's made such an incredible change for us. If I had a student 5 years ago that had a suicidal tendencies or ideations, and I would go through a lot of hoops to try and find the right sort of assistance. So affordability was a big piece of that. If I couldn't find assistance, then sometimes the families would go out without. If I could find it, it was a lot of paperwork to kind of jump through and get a scholarship. And then even when you would get the family, the services, half the time they wouldn't even be able to go because it was in a place where they couldn't access. And so bringing it back in the schools, like we can have immediate services and then evaluations on students that are in crisis, and then can have ongoing prevention for students that are suffering. It could be substance abuse, it could be anxiety, it could be any sort of crisis or mental health issue that we have at the school. And we've got the connection between the school-based health centers, and we have the connection between the clinic with the Hope the Hope Center. And then we have the 24-hour availability of the Hope Center crisis. In the past, if something would happen on a Friday afternoon, we might call the sheriff's office and see if they could do a wellness check. But now someone can go and visit the home and do a safety plan for students that might need it, like in an immediate situation. So really, like if we look at 4 A's, like alignment, really all of these community services working together put us in a much better place for our students. And with what's happening right now with COVID, I can't imagine the awful place we would be in if we did not have all this going on. The accessibility by having services at school and all these providers, the prevention providers and the crisis providers and the intervention providers coming into the schools, the accessibility and families being able to access that within the school as well. The availability of so many different services now that are coming forth, and then the affordability. We had families suffering for years and years in crisis. I was in a meeting the other day with a family that the daughter has some serious like clinical mental health issues, and because of the financial barriers, they never were able to access that. And so all the different things that we can tap into now as part of the district, the parents just broke down crying because they don't have insurance. They weren't able to get access. And so things like Olivia's fund, and we have some private scholarships that are available for mental health evaluations to get that more in depth. There's just so many different aspects to what we can do now in that affordability. So that free access to the clinicians from the Hope Center, our support in order to add more counselors at the school levels, all of that in combination has made us or put us in a position to be able to offer immediate assistance and ongoing services to kids.
Yeah, great. Thanks, Melissa. Great comments. One real quick, just a quick answer. What was the rationale? One of the questions that came in was, why are high school kids only in 2-day-a-week programs? So maybe a quick answer.
Yeah, so the hybrid model is designed because we have about 1,000 kids in each of our high schools. And so in order to limit the capacity of those classrooms, we basically have half the kids coming every other day. And that's so that we have the distance in the classroom to do that social distancing to assure that we don't have infection from student to student.
Yeah, great, thank you. Yeah. Next up on our list is Kayla. Kayla Bettis is the Outreach Operations Manager for Eagle Valley Behavioral Health. And so again, Kayla, busy job right now, lots going on, but tell us a little bit about your role and what specifically you're working on with EVBH.
Thank you, Dan. Thanks for having me, and thank you everyone for attending. My role is ever-changing and expanding within the outreach umbrella. So I work specifically with special populations, being those that we've identified in the communities over the years that have continuous gaps of services. And Melissa touched on several. There are groups of students in the schools concerning our English language learner population, special education, families that have barriers to affordability for not just outreach behavioral health programs, but in general, some of our community programs that did require transportation, did require a fee for students to participate in athletics. So a lot of the wraparound approaches that we're tailoring these initiatives to really come from the need from these populations on not receiving them prior to. And working in the past with the veteran community and the law enforcement community, knowing that there are certain entities that are missing from our service providers that can keep them grounded and a part of this community in a healthy way is something that I focus on with each of our program efforts. You're muted, Dan.
That sounds great. Thank you. Yeah, what are ways the community can give back to really what we're trying to accomplish here at EVBH when it comes, specifically to the schools, I guess, and where is it that people can really help out?
Absolutely. Well, one of the initiatives that I am helping launch is our peer support program. And what we've noticed is that there's a lot of community members in all sorts of valleys and communities and towns that automatically think just because I'm going through a difficult time or want to give back to my community and be there for somebody else, it needs to be through a clinical pathway. And what we as EVBH are partnering with other organizations such as Building Hope in Summit County, the Cats Amsterdam Foundation, is that there's ways to engage in the community and support others through a peer initiative. So if you want to get involved and you want to help and be trained on how to identify needed supports for your neighbors, for your friends, and for others in the community, you can be a part of our peer support program, which has launched at last week. So that's very exciting. And there's also ways to volunteer. There's a lot of different initiatives and programs through My Future Pathways and Mountain Youth and our nonprofit organizations in this community that before EVBH was created have really provided the foundation of sustainability for access for so many of our community members. And they are still very much working closely with us to help expand those programs and make sure that they're accessible for people to get involved and help. And of course, there's also donations, which is a huge pillar of help and support and how we were able to fund our organization to begin with from the generous donations of members of the community.
Yeah, no, that's great. Thank you, Kayla. We are getting several questions in, so we may jump into the question and answer period. And again, this could be to any of you. Culturally, you know, we've got diversity in Eagle County that we celebrate and embrace. But what are the challenges, or what are, you know, maybe Melisa, regarding the schools specifically? How are the districts or the district addressing that concern, and is the service and the opportunities available for everybody? So you're on mute, Melisa.
Are you talking about like culturally responsive and responsive to our various community members?
Yes. Yes.
Yeah, now, you know, what Kayla had said, like prior, a lot of our families weren't accessing at all. You know, there's the barrier, I think, especially in the last couple of years when families became fearful of public charge, that it can come back, you know, that somebody would track if we had families that were undocumented, especially, that someone would come back later and say that they had used services. And so I think that there was an avoidance in a lot of our families in the community for even seeking help if it was available. But now, because of the school accessibility and the free of charge, I do believe, when I've talked to counselors are under me at the district, I do believe that we have a lot more students that have kind of, if it was a stigma thing, have reduced the stigma for utilizing the services that are offered at the school level, and are accessing it more freely. And I think there's more talk about it in the community. And you know, teachers, thanks to Eagle Valley Behavioral Health, we were able to do a huge training with teachers this summer. They did it on their own time, and Eagle Valley Behavioral Health helped us compensate them for that time. But they did Safe and Resilient Schools training, which really helps our staff look at trauma-skilled classrooms and really looking at how mental health issues can play into behavior and academic success for students. And we had almost 300 people during their summer break elect to take that. And we are seeing the staff utilizing it in the classrooms. You know, I've had teachers come back and say, you know, probably before I would have thought like, oh, that kid is doing whatever, you know, and now they're really trying to be more cognizant about what are the issues behind the behaviors that they're seeing with kids and the disconnection that students may be having to the classroom. And so I think that all of that really pulls into like that cultural competency piece, and at least that awareness of encouraging equity of access to services in our schools. But we do see more families also engaging in question and answers with the new virtual format. And so I think that opens up some accessibility for families, that they can access some things through the privacy of their own home. Now that the district has been able to get one-on-one devices for all families and students, and hopefully good internet access, so that family members can also participate more so with engaging with the school when their student has an issue or outreach. We also have done some screens with students to look at their anxiety levels and how overall wellness is doing within COVID. And in the spring, we did see, as the longer that we were in quarantine, we saw more escalated anxiety levels and stress levels for students. And then with our younger students, parents reported that information. And the parents reported that they had extremely high stress levels. And so I think the key to really supporting our multicultural families is finding that right open connection that meets their family's need, and then opens the availability of it for access. And I do believe it's improving. I still think that there's always places that we can improve and that we need to improve.
Yeah.
But I do think we've made great progress with the availability of all the services that have been provided through Eagle Valley Behavioral Health in the last couple of years. We
Great.
definitely have seen more families reaching out.
Yeah. No, that's great. Thank you, Melissa. Yeah.
Can I
Interesting
jump
question.
in? And I would love to address that question also when you were talking about culture and the dynamics in our community, just working with really
Sure.
thousands of parents a year through early childhood partners. We can't emphasize this point enough. It's such an important point, and there are ways to reach families. It's been difficult. Melissa talked a little bit about stigma that's been there. I think one of the benefits of being with some grassroots or a nonprofit organization, I'll use our Family Resource Center as an example. 94% of our clients are Hispanic, and we're often the first touch point for people and for caregivers who themselves have experienced so much trauma or perhaps maternal depression. And through building that relationship with our bicultural and bilingual staff members, we're able to kind of be that handoff to then help them access services. So it really can be effective. Also, offering all services in both English and Spanish is really important. But in our community, I mean, our school district is, half or a little over half of English language learners. So we just know that there are ways to reach families, but we have to be very mindful and very cognizant of it, and it can work. Going into neighborhoods, that's been another really effective strategy, going right into neighborhoods and having neighborhood dinners in communities in different ways. And we've been really fortunate. That's been something that, we've collaborated with Eagle Valley Behavioral Health on as well. But I just kind of wanted to highlight that in terms of the effectiveness, and that there's really got to be multiple touch points to get people the help they need, because a lot of our parents are suffering. And if our parents are suffering and not getting help, our children will not be healthy when the family isn't healthy.
Yeah. No, good points. Thank you, Liz, for bringing that up. A question came in, maybe Teresa, that you could address, and it's kind of it's an interesting, I think, going off of one of the things that Melissa just said. We've gone from 20 miles an hour to 100 miles an hour this year in regards to services and availability. Are kids getting overdiagnosed, do you think? Is there any fear that by again, the additional services or the clinicians available, have we gone too far, or have we not gone far enough?
Yeah, thanks, Dan. I think that's a great question. Ultimately, I will say, as far as the Hope Center and the clinicians at the Hope Center, because our services are free of charge, because we are not dependent on insurance reimbursements, we are not required to diagnose. So if you look at specifically, it's kind of funny. In my doctoral internship, my supervisor used to say, "Teresa, you're a great clinician, but good thing you're going to go work in the schools because you're really bad at diagnosing." And it's actually something that I feel passionate about when it comes to children and adolescents. Diagnosis can be sometimes very appropriate and very necessary to direct the path of treatment and to get those supports necessary. And it's important to be very cautious not to overdiagnose. Talking with a clinician yesterday who is supporting a student with suicidal ideation. That suicidal ideation began in April, which is directly linked to COVID, to isolation, it does not qualify this person for a mental health diagnosis, but definitely the supports need to be there to help this individual.
Yeah, great. Along I guess a different question, but again, directed probably, Teresa, for you. What about the private schools? I guess, what is the Hope Center doing we've got several private schools. What's the support like there, and how do the programs differ, if at all, from the public school?
Absolutely. I think that's also a great question. We have added one private school this fall, this school year. So essentially, we have the availability, or we can be in private schools. Kind of the difference is, or the reality of that is that private schools pay for half of the financial obligation, and EVBH pays for the other half. So we do have that capacity. Our kind of future goals and dreams are to continue to increase our outreach and ability to be in all schools. But the short answer is yes, we absolutely do, and that's what it looks like.
Great, good, thank you.
Can I add something, Dan, too? Like, I feel like the Hope Center has done an amazing job of matching clinicians to the schools to meet the need of the particular either population or something that's going on. For example, like the Vail Ski and Snowboarding Academy has a clinician that has a background in sports psychology, you know, to help the students through the stresses involved with that. So I feel like it's a great service, and I think that probably with the private schools, they will do something similar and like really try to match the right clinician with the environment that the school has going on.
Yeah, well, I know EBBH wants to help all the kids in the Valley, and so certainly, you know, where there are opportunities, we are looking for ways to, again, create those partnerships. Melisa, another one for you, and it really, I think it's a question I've heard over the last couple months, really, since school started. You know, I know there's been some comments about why aren't kids in school more, and I think you talked about just from a physical plant standpoint, it's difficult. Are there other reasons, or, you know, again, hate to go back to that same question, but I think it's
yeah, I think we heard a lot from elementary parents because we have that Wednesday that has the remote learning right now. You know, I know everybody we would love to be in 5 days a week as well. I do think we've made great strides compared to other districts. I know DPS just had their first day back yesterday of in-person. So, you know, we want to do what we can do to really support the economy of and the well-being of our families by having kids in school. We know it's the best place for them. One of the strains on the system, though, is we also have to look at the wellness of our staff and the amount of time that they have to properly prepare for the different learning environments in which they're in. Like we talked a lot with our staff. We do check-ins about zones of regulation, which is a check-in that we do with kids, but we actually do it with our staff as well now. So, I mean, we also need to look at their stress levels and what's happening as far as them having time to do what they need to do in school. And so the 4-day-a-week that we have right now, when students are in that, because we are cohorting so tightly, the kids don't go to a special. So they don't go to art or music or PE. We do everything within that small group. Same thing with lunch and overseeing recess and that kind of thing. So the same adult is with them all day long from bell to bell. And so in a normal kind of setting, we would have where they would have a release so that they could do their planning and they can do their grading and they can do their prepping for the next day. But in the system that we have right now, they do not have any of those breaks in the elementary schools. They go straight bell to bell, Monday, Tuesday, Thursday, Friday. And then on Wednesdays, they all come in and work. But what they're doing is their professional development, they're doing their team planning, they're doing all their evaluations of student learning. So working with the principal and others in the school to see how the kids are progressing and growing. And then we also have all of our special meetings on that day. So students that have special service plans and interventions and IEPs, all of those meetings are happening on the Wednesdays as well. Also with COVID, we're actually very happy that we did select Wednesday as the day because it kind of gives us a little cool off period when we're doing contact tracing and gives us a day to do some really deep cleaning of the buildings for disinfecting. And we actually have like bus drivers and some other staff that may not be running routes that day coming in to assist the custodial staff to do some really deep cleaning on those Wednesdays to help make our school environment safer for everybody.
Yeah, great, thanks. I'll come back to you in a second, Melisa, but maybe Teresa, you know, stress levels are up, and I think it's really, you know, I think it's manifested in some cases with substance abuse issues. Is there an individual case dynamic regarding that, or is it really education for our kids? And maybe Liz, you can weigh in on that as well.
Yeah, I think that's a great question. We're definitely seeing, especially in terms of school age kids, we're definitely seeing an increase in higher risk behaviors in the high school population. And we're also hearing reports from kids about higher risk kind of behaviors and maybe unhealthy patterns of coping within parents and families. I think substance abuse is huge. I think there's certainly a psychoeducational component to it. I think there's also a kind of realization of using substance use as a coping style and a coping skill. So recognizing what the stress is, what the anxiety is, and increasing the ability to access other methods of coping.
Yeah, Liz?
Yeah, I mean, I think that we've seen the stress across the board that's led to many things, substance abuse, including also, you know, many cases of working with families and women in particular with increases in domestic violence. And some other challenges that we've seen and, you know, working with families, there's multiple kids, so they certainly span school age. I think that Melisa and Teresa would say the same. We've seen some complications with substance abuse, with domestic violence, with families in very tight quarters, sharing homes, and in times of COVID, that has absolutely placed an enormous stress, especially if somebody gets sick or when kids are trying to learn virtually and you have, you know, multiple families sometimes sharing a small space. We've definitely seen the impact in that with domestic violence and increased substance abuse. And I think that the outreach that's happening needs to continue to happen. I'm sure that this is happening across the nation and if not world in these times of increased stress, but you know, it's definitely been a real issue.
Yeah, no, it's a hard one. Yeah, Melisa?
I've heard so many parents say, I can't do that again. You know, what we did with them trying to work from home and trying to manage their students' learning. You know, it was just too much for a lot of people. And then as far as our students, our high school again is that level that we're particularly concerned about. And we do see an increased number of high school students that are having to work and support their families. And so they're trying to juggle basically a full-time job on top of high school, on top of those stressors. And we are seeing in our academic data from the first quarter of the year, a concern in that in a normal year, we would probably have under 10% of kids that would be getting Fs in classes, but right now we're hovering at our high schools at about 20% of courses right now have individual students with F grades, which shows us that they are either not able to fully engage or not manage all of the different pieces and aspects that we're throwing on our teens right now. You know, some teens, it's just the social isolation that's affecting them. Others have a really hard time with being a very independent learner and managing their time well. Others, it's accessibility. And then others, again, is working full time and trying to support family and family needs, and then expecting them to be a student full time and do well with that. You know, it's things all of our adults are struggling with, but I think it's just magnified for our teens right now.
Yeah, no, it's a tough environment. I guess maybe it leads to a question that's not unique to Eagle County, but as an industry, do you think that we will see kids repeating grades? Is the education, you know, experience abbreviated to the point that the kids won't learn what they need to learn?
Well, we're trying not to do that. We did have quite a few kids that did some credit recovery this summer. Because in the fall, in the spring, sorry, we held harmless a lot of kids. We gave them a no grade versus an F, which meant that it didn't negatively affect their grade point average. And then what we're doing with a lot of our courses, because they did come back generally a little bit behind where we would expect them to be at the start of the school year this year, we've really tried to compact those priority standards and really focus on those more. But that, you know, inevitably means that they will be missing out on some of the learning that they would have in a regular year, because we're having to go back and reteach some concepts while we have the kids in person, and then really restrict the breadth of the curriculum, really focusing more on those core competencies that students need to get. But we are concerned that students are going to be lacking credits. And for the graduation this year, the district we made a temporary year adjustment to reduce the amount of credits needed for high school graduation by 1 credit this year. And so that would come out of more exploratory classes, not out of their core, math, science, those kinds of things. But, they may not take a couple other exploratory courses, which they may have in the past. But it is very difficult, especially in a remote environment, for students to juggle a course load of 7 courses. We ask college students to juggle a course load of 4 generally, maybe 5. And we're asking our high school kids to do 7. So something has to give. And we are seeing it in some cases in grades. We're seeing it in some cases of the disconnection or the disengagement from school in general. In a regular year, we would have not as many kids at risk, but right now on my roster is over 70 high school students that are currently not engaged with us in any way, or very little engagement, not enough to get credit. And then when I go back and I look at that students' grades, it's almost all Fs. And at this point, they can't dig themselves out for the semester because we're already halfway through. And so, this is what we're struggling with right now, and hopefully working to engage with other community organizations to help us contact these families, see what we can do to support. And again, it is in general more so our at-risk population. So our Hispanic and our lower income populations that we're having those biggest issue, or the most, I guess, issues as far as number of students in those situations.
Yeah. Melisa, is the district considering, again, I think there's a lot of questions around, how do we get these high school kids back in the classroom, at least for some period of time? Is the district looking at adjusting the schedule for the last half of the year at break, or kind of what's the plan?
Well, right now we are definitely trying to evaluate where we are and how students are doing. We have some students that are doing really well with it, and then we have some students that are doing very poorly with it. The constraint that we have is actually the physical space. Right now we are able to do contact tracing at a tighter level, which kind of when we started, we would have to almost take the whole grade level out when we had a positive case. But now we've had 0 spread. So we've had 0 transmission in the school of student to student, student to staff, staff to student, which is amazing. So all the cases that we have or have had since school started have been with they sent a student to school that had a positive family member or a sick family member that they didn't know was positive, and that student ended up being positive. So I do think that we can probably increase some cohort sizes because of that. We are feeling very comfortable that schools are safe as far as transmission, or much safer zones than other places. I think you're much more at risk if you went to a grocery store, or you went to a Walmart, or you went to a gas station than you are in schools because of all the procedures that we have in place. But at this point, we have not looked at a total schedule revamp or anything like that. It's just really hard to tell where we're going to be in the next couple weeks. So everybody that's listening, please do your best to behave and socially distance so that our community doesn't go into red. But I do think we are having those talks and what we can do to better support the students and families in the system we have going right now.
Yeah. Well, again, I would encourage, I think this comes from a lot of high school parents, it's great news that it's really not spreading the way that there was some initial concerns that it might. So maybe that does open up some opportunities, and, just keep us all, in the loop. I guess kind of last question, and then we'll kind of wrap it up because of some time constraints, but, what else can the community do? And I think I would direct this to all of you. To promote mental health and really support our kids and family members. It's been a difficult situation. It doesn't seem to be getting any easier, but maybe real quick answers from each of you if there's a specific thing that you feel would make a difference that the community can do. Liz, do you want to start?
Sure. I think we'll certainly all have a brief thought on that. I think that what we always look at, and this is throughout the lifespan, it doesn't matter whether we're talking about kids or caregivers, but connection, as much as possible, connection in multiple ways, in a variety of ways. I mean, connection is really the best way to promote mental health and to combat mental health problems, including substance and some of the other things we talked about. So I really think that is things that we have to continue to do. I know certainly in our organization we're doing it and we're creative about it, but finding those opportunities for families to connect with other people and our kids as well. Connection.
That's great. Good answer. Teresa?
Yeah, I'll just kind of piggyback on that, Liz. I think connection, talk about it. Talk about it between yourselves and your neighbors. Talk about it with your children. Talk about it with your kids. Using age-appropriate language to talk about your own stress and what you do to support that. Destigmatize the mental health in general, and the importance of accessing help when sometimes it is too much for us to deal with it individually. There's nothing wrong with that. We all need outside help at various times in our life. So talking about it.
Yeah, great. Melissa, any other thoughts?
Yeah, I would say from like an employer perspective to please value families first. Our families are under so much stress right now, and some of the situations that we've been in since school started is because parents just have to work. And I don't know if there's anything that we can do as a community to help support people staying home when someone is sick. Because it's a matter of eating and getting rent paid or, following public health orders. So, anything that we can do to help support those families. And I think we've done a great job of making those connections, but I still think that we have a lot of families that are afraid to or are embarrassed by asking for help and reaching out for help. And that's just not only mental health help, but just kind of general support during COVID for financial resources and that kind of thing, housing allowances or pieces like that, because those are the things that kids shouldn't have to worry about, but they do. And those stresses are coming to school. And I think anything that we can do as a community to help support that safe quarantining, that isolation time that needs to happen so that we can defuse some COVID outbreaks in our community is going to be key, because I do think that what we have been saying the whole time is that COVID building on top of the already stress, what we already had going prior to COVID, it just exponentially adds issues to families and to students. And so, and from your own personal perspective, like do everything that you can to help keep our community safe, because we do want kids to come back to school full time as much, but we can't just in the environment that we're in right now with the contagion. And so please help us to do that by keeping yourself and your community members safe.
Great. Well, thanks everybody. I feel like we could go on for another hour. It's a relevant conversation, but thank you all to the panelists. We lost Kayla a little bit ago. She had to run to take care of something, but we appreciate everybody's involvement today. And for those of you listening, again, thanks for your support. If you've got questions, go to ittakesavalley.org. We'd love your, again, continued contributions, your continued support. And again, we appreciate everybody. So our next town hall will be in December. There'll be some information that goes out probably mid-November, letting you know when that is. But again, I appreciate everybody's time today, particularly our panelists. Good conversations. Thank you.
Thank you.
Thanks.